Hi, my name's Erin.
I'm Kathleen.
We're both midwives at Midwives of Mississauga, and we have made a little video here for you to learn a bit about what it might be like to be in the care of midwives for your pregnancy and birth, and with the hope of helping you make a decision about what care provider is right for you and your family. And then we just want to advance our slides. It's giving us a hard time. There.
So just as a short background, midwives have been a regulated profession since 1994 in Ontario, and we are primary healthcare providers for pregnancy, labor, birth, and 6 weeks postpartum. The midwives at our clinic currently hold privileges at the Trillium Health Partners hospitals. So that means we use the Credit Valley site and the Mississauga Hospital as sites when we need to run assessments, or if you're having a hospital birth, or if we need to use some of the professionals that work within our community.
All pregnant people in Ontario have a choice of care provider for their birth, for their pregnancy and birth. That would be a midwife, a family doctor, or an obstetrician. Not a lot of family doctors are doing maternity care beyond the second trimester. I think it's hard to be a family doctor and run a whole regular practice and also be on call for births. But some of them do because they love it. Mostly people are looking at a midwife or an obstetrician. So that's mostly what we're talking about. And midwives, we focus on low risk normal pregnancies. So that is the vast majority of pregnancies, with pregnancy being a state of health. So there are a lot of similarities, frankly, between how we practice. We are all following evidence-based care here in Mississauga, especially. So we're looking at guidelines from sort of governing bodies in the hospital and new research. We do the same schedule of visits. So we're going to be seeing people at the same points in pregnancy. And midwives can order all the same routine testing and medications related to normal pregnancy as the other care providers. So there are situations where things might end up outside of the midwifery scope, and we'll talk a bit more further on about what that means.
So what midwifery care actually looks like is we provide prenatal care. So that's visits throughout your pregnancy. Early on, we don't see it as frequently just because there's not as much ground to cover, really. So typically in the beginning, we start to see every 4 to 6 weeks. As you progress, we start to see you more frequently. So at 28 weeks, we start to see you more like every 2 to 3 weeks. And in the final month of pregnancy, 36 weeks onwards, we see about every 1 to 2 weeks. There's some flexibility in that schedule. So if someone has a very uncomplicated, straightforward pregnancy and not a lot of questions, we might sort of make those spaces between visits on the longer side. If there are more things that we need to cover or complexity that we need to watch more closely, we'll recommend that we see you closer. And that's really sort of a case by case and a visit to visit decision that we make together. We attend your labor and birth, and there are 2 midwives that attend every birth. And then we provide postpartum care for both the parent and the baby, and that extends for 6 weeks postpartum. Typically, we see people at home in the first 10 days or so, and that usually looks, again, there's some flexibility, but usually we're seeing people around day 2, day 4, and day 8. That's sort of our typical schedule. We add on more visits if we feel that's necessary to monitor the things that we look for. So making sure baby's gaining well and feeding well, that we don't have any concerns about the recovery of either the parent or the baby. And then after those first sort of 10 days, 2 weeks, we start to see people back in the clinic. That's usually around 3 or 4 weeks postpartum. And then your final visit with your midwives is around 6 weeks
Graduation.
postpartum. Yeah, exactly. We graduate you on to your next primary care provider, which is typically a family doctor, but sometimes a pediatrician as well.
Yeah. And while you're in care with us, you do have access to your midwives with a pager for emergency concerns. And we have other mechanisms to keep in touch with you between appointments as required.
Mm-hmm.
So a little bit about the philosophy of midwifery care, which is maybe one of the areas where we can be a little bit different than other providers. Something that is really important to us is informed choice. So we really see our role as midwives as providing you guys with the information that you need to make the right choices for your family. We're always going to talk to you about the community standard and what the sort of typical approaches or evidence-based sort of guideline approaches. We'll share any new evidence or research information that might be around. We'll always make specific recommendations based on your pregnancy specifically. So if there was something that was related to you specifically, we'd make sure you know. And we tend to give you this information a little bit in advance of the decision point so that you can take it home and think about it and do any research you need to, or talk to your family and come back to make a plan. At the end of the day, we don't really care what you decide because we've done this work with you to make sure that it's an informed decision and that we know that you really understand the risks and benefits of the choices that you have. Something else that is important to us is appropriate use of technology. So we are always looking at birth and pregnancy as a state of health, and walking that line between making sure that you're having appropriate care and not overusing things as well, or over intervening in things.
Yeah, and especially because we sort of come at it by at considering that pregnancy is a normal, healthy part of life.
Exactly, yeah. Midwives, of course, are offering a choice of birthplace. Here in Mississauga, that means home birth or hospital birth. We do not have a birth center in Mississauga, sadly, despite continuous advocating for it on our parts. And getting to the birth center in Toronto is way too far away. So we would be having babies on the side of the Gardiner, which is nobody's choice of birthplace, is the side of the road. So here in Mississauga, we're talking about home or hospital. We're very fortunate in this community to have really excellent choices, or really excellent hospitals to work with. But it can still look a little bit different at a hospital with a midwife. You have access to all the same things, but it can be a quieter vibe sometimes. You're in a room with your midwives, and other care providers will be invited in sort of as appropriate, which Kathleen will talk about a little bit more in a minute. Early discharge, midwives are able to offer early discharge for people who it's appropriate for, and that would be leaving sort of within about 3 or so hours after the birth instead of staying at the hospital. I'd say we're pretty conservative in terms of who we offer this to, because we want to make sure that we're only sending people home who are comfortable going home and who we feel are safe to do so. And this is something that I think it's a wonderful option for people who are having a really low risk normal birth. Really, though, it's a decision we can't make in advance because we are not in charge of what happens at the birth, and we have to wait and see how things go. But that's one of the things that's a little bit different about how we provide care.
And one thing that I forgot to mention earlier too, in terms of the hospital sites, is that right when you come into care, we assign you straight off to one hospital site or the other. So the Credit Valley site or the Mississauga hospital site. And we do that when you come into care because we have to make sure we have sort of as a clinic that we're doing about 50-50 at each hospital in terms of percentages.
We don't want to create a traffic jam.
Exactly. And so when you come into care, that'll be sort of communicated to you about sort of, it's a first come, first serve, more or less situation where you're pre-assigned. Most of the time, the hospital that you're pre-assigned to is where your assessments and birth will take place. There's a small number of situations each year where we might have to reroute someone. So if there's a situation where, let's say, all the midwives are at one site and then you're planning your birth in the other site and it's just very busy, we might say, come on and join us at the other site. The other scenario where that might happen is if there's an urgent, like a true emergency, and we're saying you need to get to the closest hospital, and then we'll direct you there. So those are the sort of, I would say, the exceptions rather than the rules, but typically when you come into care, we'll let you know where you've been pre-assigned, and then that's the plan going forward. The other piece of midwifery care is we're really sort of believing in this idea of a core team and collaborative care. So what that means is with our clinic, we work in teams of midwives. So currently there's 15 midwives at our clinic, and we work in teams of 3. So You get assigned to your little team of 3, and you get to meet those 3 midwives throughout the course of your pregnancy. Now, the way I describe it is, out of those 3 midwives, we're never at the same place at the same time. So when I'm doing clinic, my teammate is doing home assessments, home visits, births, hospital assessments, all that sort of stuff. The 3rd midwife has a little off-call time, and every week we change who's doing what, and it sort of cycles around. What that means is, throughout your prenatal care, you get to meet all 3 of your midwives, and then one of those 3 is the person that is planned to be, or one of those 3 would be present to take your pages, do your assessments, and attend your labor. Now, again, we make these plans. Sometimes nature has other plans.
We're not in charge.
Yeah. So, luckily, because we are a large practice with lots of midwives, that means that, if your midwife has been awake for a very long time and needs sleep relief to be a safe practitioner, if there's multiple births happening at the same time, we get a midwife from one of the other teams to either take over or be there for you. So it means that, you don't lose midwifery care. You might have a slightly different face, but I would say, again, that's sort of the exception rather than the rule. And we all practice very similarly within the clinic. And so we like to describe it as sort of, you've got your core team. Those are the folks that you're going to see the most. They are most likely the people who are going to attend you, but we are also human. So every so often you get to see other midwives potentially. And then we collaborate with other professionals, which I think we'll be talking about next.
Yeah.
So what happens, we're talking very much about low risk, normal, healthy pregnancy. So what happens if the unexpected happens? Something complicated shows up while you're pregnant or in labor or afterwards. We don't hesitate to involve other professionals if we need them. So, sometimes this can be really straightforward in the sense of, if there's something that's slightly out of the ordinary or needs a little higher level recommendations or care, you might just need an extra appointment either with an obstetrician or a pediatrician or endocrinologist, something like that. And sometimes it's as simple as an office visit. Sometimes in your labor, sometimes we might invite the obstetrician who's on call to come in and give recommendations about your care if things are not proceeding in a low risk kind of manner. Now, there are some situations, it doesn't happen that often, but sometimes we say, this is really out of our sort of scope of care, and you're much better off under the care of a high risk specialist. And if that's happening, we facilitate that happening. So, we are very familiar with all our obstetric colleagues in the community, and we would facilitate that transfer to whoever's appropriate in that case. And then typically what we would do is, even if your care is transferred, we often will play that role of a supportive, like a non-clinical but supportive role. And that sort of can look a little different depending on what your situation is, but we don't just sort of disappear. We are sort of more in the background and figure it out as we go along.
And finally, so we are a teaching practice. I'm very proud to be a teaching practice. So we are affiliated with the Toronto Metropolitan University. So mostly you would be seeing midwifery students from TMU. And there's a real variety of midwifery students. So often there'll be a student around. And these can be students who are at the very beginning of their learning or at the very end, when their last few weeks before practicing as a solo midwife themselves. Your core team will always let you know who to expect around and who might be involved in your care. And midwives or students, the whole time they're with us, they are supervised. So if it's a very early sort of student, really everything they're going to be doing is watched by your core team. And then the students who are just about solo practicing are still supervised, but maybe a little more in the background by your core team. So I think having the students around is wonderful. We really love it as midwives ourselves. They bring a really wonderful energy and excitement about midwifery. And it is also really an advantage not to be underestimated to have another set of hands around, especially during the birth and times like that. We also do some teaching for other healthcare providers, other health professions in the community. So in particular, some of the more common ones would be PL paramedics we have following us at times, and some nurse practitioners as well. So maybe a little less often than the paramedics. So there are definitely other health professionals that you may meet as a part of your time here with us.
I guess the only other thing I'd mention is for our midwifery students, because they're with us for so long,
Yeah.
we assign them to a team. So they have that they're built into your team. So they're not just showing up at the very end.
Yeah.
You get to know them over the course of your pregnancy as well. And we try to make that happen as well.
Yeah. So I think those are the big things we had to talk about. Thank you for taking the time to listen to the video. And we hope it helped you as you make your decision.
Thank you.
Thanks. Bye.